Menopause is defined as a complete cessation of menstrual activity for more than 1 year. For more than 1 year. So the average age of menopause in Indian women is 47 years. So how do we diagnose menopause? So first of all, if she has not no menstrual activity for more than 1 year, it is likely to be menopause in the appropriate year. And then since there is menopause is because the ovarian reserve gets depleted, so there are no more primary follicles in the ovary to ovulate. So that's why the ovary becomes inactive and starts producing estrogen and progesterone, because there are no follicles at all. So the pituitary, however, uh, bombardment pituitary is doing with all its gonadotropin releasing gonadotrophic hormones on the ovary is not responding. So this is basically a scenario like hypergonadotrophic hypogonadism, right? So FSH will be very very high, and if FSH is more than 40 microinternational unit per ml, then it is diagnostic or confirmatory of menopause. Now if this same scenario happens at less than 35 years of age, that is known as premature ovarian failure. Now how does menopause pre- before menopause, the woman has a balance of estrogen and progesterone, and estrogen had several effects on bone. It was protective for bone, it was protective for the heart, and it had a vascular stabilizing effect. So once estrogen is gone, there will be osteoporosis. There will be osteoporosis of brittle bones, increased risk of cardiovascular sequelae, and also most common vasomotor symptoms. Vasomotor symptoms like hot flushing, There is also mood instability. There is also mood instability. Right? So if these problems are increasingly high and it's hampering with the woman's normal day-to-day activity, then we need to supplement her with estrogen and other required hormones. So most common is vasomotor symptom, and most common indication for hormone replacement therapy is also vasomotor complaints which are intolerable. Remember pregnancy, there are three variants of estrogen: E1, E2 and E3. That is estriol, estriol, tri, estradiol, and estrone 1. So estradiol is the most potent estrogen, and is most commonly during the reproductive age. Most commonly during the reproductive age. Estriol is a weaker estrogen and is mostly seen in pregnancy. And estrone is the estrogen of menopause and weakest estrogen. It's the estrogen of menopause. Right, so you can remember this as like in the reproductive life she is with a partner, so there are two members. In the pregnancy there is one more member added, and after menopause she is a lonely lady, so it's one, just a silly mnemonic. So what are the medications that can be used for hormone replacement therapy? One is estrogen, but that estrogen it at a much lesser dose than the estrogen that we give even in the form of low dose ocipils. So it's 0.625 microgram daily estrogen is supplied. Now whenever we are giving estrogen, we must counter the estrogen with progesterone.